Welcome. So, rediscover life without chronic pain. So just a little bit about me. I'm Dr. Sorin. I'm an anesthesiologist and board certified pain specialist. I went to Loma Linda for medical school, and then UC San Diego did my anesthesiology and pain management training, and then married my beautiful wife. And then we decided we want to have a family, and so we decided to leave that Southern California area and moved up here to the beautiful Northwest, and we're super grateful to be here and so thankful for this community. I think we bought our place up here in 2006, and so I think we came up here full-time 2010, and we founded Idaho Pain Clinic. And so I'm a board certified anesthesiologist, pain management specialist, and I just put a picture there of our 4 children. We came up here, no kids, just my wife and I, newlyweds, and we're very grateful for this community and everything that it's allowed us to do. So I also want to thank Nevro. Nevro's sponsoring this event, and some of their slides come from them, so big thank you to Nevro. So in pain management, there's kind of a scene that I've seen over and over, right? We go through our lives, we work hard, we try to make this nest egg, try to achieve the dream of retiring someday, of exploring the world, of maybe sitting on a beach somewhere beautiful. But unfortunately, the reality for many people end up with injuries and chronic pain. So the golden years end up not being so golden and so great because people end up spending them visiting doctors, and unfortunately I see them myself, and others of you that I see in here, have been injured in the line of duty, just trying to do the best you can at your job, and so you're injured and suffering with pain. And, I've had this, lately I've been thinking a lot about what my purpose is in life and what God has called me on this planet to do. And, I realize that one of the things I'm supposed to do is help people cope with chronic pain and give them hope again. In the Bible, in John 10:10, it says, the thief does not come except to steal and to kill and destroy, but I have come that they may have life and they may have it more abundantly. So I really believe that's the destiny that God wants for each of us, to have life and have life abundantly. So I want to talk tonight about a chance to help people regain a life that's filled with joy and independence. So let's talk a little bit about chronic pain. What is chronic pain? So pain, you got 3 different kinds of pain receptors, but basically pain is the interpretation in your brain from the sensory system about uncomfortable sensation that your body is experiencing. The information is sent to the brain via nerves. So you may have a nerve, you stub your toe, goes from your toe to your spinal cord in your back, and from your back, then it goes up to your brain, where your brain then interprets it. And it's interesting because there's a lot of different factors that affect how the brain interprets pain. Now, some of those may be physical, mental, and emotional, right? We all know, depending on your emotional state, the pain may be amplified or de-amplified. And so this is the area I want to focus on tonight, is on a way that you can stop the pain signal from getting from your, wherever your body's sending that pain signal up to your brain. So what is chronic pain? Chronic pain is when it persists for several months despite treatment and natural coping efforts. It can be caused by an injury, infection, or ongoing ailment. And oftentimes, there's emotional components to it. And we all know this, and I see it in patients, right? It affects your life. It affects your relationship with your spouse, right? It's hard to live with somebody that's in chronic pain if they're, grumpy and on edge all the time, right? Because they're in pain. Some of the things that maybe you used to enjoy doing together, the loved one can't do, and oftentimes there's even guilt from that person that they want to provide this to their spouse, but they're physically unable to do the things that they used to do and enjoy the things they used to enjoy. So roughly, unfortunately, 8% of the adult population suffers from chronic neuropathic pain. And I want to just take a moment and talk about what neuropathic pain is. Now, there's normal pain, right? If you pinch yourself or if you stub your toe, you'll get pain. And that's normal, right? That's good that we have pain receptors, right? People who don't have that end up burning themselves, or diabetics can end up losing a toe or breaking a leg and not knowing about it because their nerves aren't functioning normal. So that's called nociceptive pain. That's normal pain. So pain is normal, and pain is actually not a bad thing. It protects us from harming ourselves. But what is bad is when you start getting neuropathic pain. That means there's been some sort of injury or chronic tissue damage that now continuously sends that pain. And that pain signal continuously going to your spinal cord and up to your brain, continuously firing. It actually causes changes inside the spinal cord, neurochemical changes inside the spinal cord when you have this chronic pain signal being sent. So the majority of this chronic pain is chronic lower back pain. It's probably the most, actually I'm pretty sure it is the most common reason for a doctor's visit is lower back pain. And it has a huge, massive cost to our economy and to those in physical labor jobs, right? That's a big risk of getting chronic back injury. So how do we approach pain usually? Well, the most common things are the first layer there of pharmacological therapy, lifestyle changes, and physical therapy. So pharmacological therapy, which most people, when you get an injury, you've probably tried. There's 4 main categories of medications used for this. First one is the anti-inflammatory drugs. That includes things like ibuprofen, aspirin, naproxen, those categories of medications. Those are the anti-inflammatories. Then you have muscle relaxants like baclofen, cyclobenzaprine, scalaxin, robaxin, those types of medications. So those are all muscle relaxants. Then you have the neuromodulating agents, the anti-seizure medicines like gabapentin, pregabalin, which is Lyrica, Neurontin. So those kinds of medicines work for nerve type of pain. And then lastly, of course, we have the opioids. Now, opioids, if they were a wonderful panacea, nobody'd be in pain today. But as you all know, there's lots of different complications associated with the opioids. They do work well in the short term, but long term, they don't quite work as well. So that's a category of medications. And then the last two, I think everybody should be trying to do those every day. Lifestyle changes, meaning eating healthfully, exercising, sleeping properly, those types of things. And then physical therapy. As some chiropractors say, motion is lotion, right? So keeping the muscles, joints moving and strengthening, keeping your core strength, all those things are good. But unfortunately for a lot of, especially neuropathic pain, those don't quite cut it. So then we go to the next tier, which is the nerve blocks, the epidural steroid injections, the radiofrequency ablations, rhizotomies they call them sometimes, and other ultrasound guided injections. So those definitely have a place. And sometimes when somebody's in severe pain, those injections can kind of push them, or for some people they kind of help them. They get them a couple times a year and they help them be able to stay active. Because to me, one of the biggest goals is to keep people functional and stay active. Right? Before, I think especially when this probably caused the opioid epidemic, because they kept pushing, what's your pain score? What's your pain score? And they're so focused on that. But today, I think we're much more focused on functionality. What are you doing? Are you able to within reason, do things you enjoy doing, you want to do? Let's set goals and let's focus on functionality. So then we go into the most invasive options, which include spinal cord stimulation, which we're going to talk about tonight, and then surgery and pain pumps. Surgery is absolutely life-saving. As I look around, I'm sure a lot of you in here have had back surgery, and some of them have worked and others haven't. So surgery is an absolutely necessary part, except there's times when it doesn't work, or somebody's not a candidate, or somebody just straight up does not want to have surgery. So that's where spinal cord stimulation can play a role. So let's talk a little bit about spinal cord stimulation. This is not a new therapy. It's been around since the 60s when they were first doing it. And basically spinal cord stimulation consists of, and I brought some real spinal cord stimulator here. So basically consists of a wire, and I have a real one that was actually in a patient that that was removed and sterilized. So if you want to see that, but I think this is a real lead. This is a real lead. Yep. So these leads get implanted in the epidural space which again, if any of you have had children or children that have had children and they get an epidural, it goes in the same space in the back. And it's got some metal electrodes here. And these electrodes can emit an electrical, oh, you're going to pass it around? Okay.
It's clean.
It's been sterilized, okay? It's autoclaved, but so these electrodes emit an electrical signal. And the way that electrical signal does, it works to block the signal coming through. So think of a white noise machine that can block out sounds. In the same way, the spinal cord can only handle so many signals going up to the brain, right? So you got a pain signal going up to the brain. So instead you use these electrodes to emit a signal directly on the spinal cord that basically washes down or drowns out the painful signal going up to the brain. So, and then this is connected to a small device. It's similar to a pacemaker. A lot of the same companies that make pacemakers make these devices, similar technology. So this gets implanted into the lower back usually. So basically thin wires and a small pacemaker-like battery pack, which is called the implantable pulse generator. These leads are placed near specific nerves or in the back. And again, you may have heard deep brain stimulation for depression, for Parkinson's disease. There's all kinds of other uses for these types of neuromodulation, these generators. The pulse generator is placed under the skin near the lower back, and the pulse generator delivers mild electrical impulses to the nerves on the back, disrupting the pain signal to the brain. And then lastly, when it was initially invented, they did what's called traditional or low-frequency spinal cord stimulation. So they used a frequency of like 200 to 800 hertz. That means 200 times per second. So people would perceive that, and it'd be like a buzzing or vibration pain from your back into the lower extremities. And when I trained in the early 2000s, that was the type of stimulation that we did. And it worked well. It was a life changer for a lot of people. As the years have gone on and technology has advanced, they came out with various types of pulsed stimulation to try to more closely approximate the way nerves fire and to make it less annoying to patients. And then Nevro came out with using something that was not done by any other company. They came out with 10,000 hertz, so meaning a frequency that's 10 times higher than than any of the other spinal cord stimulators can go. And the beauty of that has been that it's become what we call sub-perception, so you don't feel it anymore. So before you would feel this buzzing, tingling, and some people liked it because it was much more pleasant, and lots of people hated it. So they came out with this other option, high frequency, which your brain does not even perceive, so you don't even know that that the device is on. But what it does do, it works at the spinal cord, so it is washing out that pain signal as it's trying to go up to your brain. One simple example that we can use of this is even a young child. If you bump your knee, what's the first thing they're going to do? You're going to rub it. Why would you rub it? Would that fix the knee injury? No, but even a child knows that by stimulating the nerves around it, it washes down the pain signal, and so it just feels better. When you rub your knee or ankle, whatever you hit, it feels better. So that's the same principle used in spinal cord stimulation, except used directly on the spinal cord. So these devices, not the Nevro, but the first FDA-approved spinal cord stimulators were approved in 1989. So again, they've been approved for many decades, and they deliver mild electrical stimulation to the nerves along the spinal column. And by the way, the first ones, there was actually a battery. And the traditional stimulation sucks a lot of battery juice, so they would last a couple of years and you have to replace them. Then they came out with rechargeable units, and most of the units today are rechargeable, although we can give they still make some of the non-rechargeable, which in certain situations some people have trouble charging them, so we can still use those. So basically they modify the nerve activity to minimize the sensation of pain. And there's about 34,000 of these implanted worldwide every year. And the most common indications for it, the most common uses are neuropathic, lower back and leg pain. And then complex regional pain syndrome. So again, that's a disorder where somebody has an injury, and normally say you get an injury, you know, say you hit your hand, it becomes red, hot, swollen, painful, and then it turns off and off you go and life is good again. Well, complex regional pain syndrome is a syndrome where the body forgets to turn off all those signals, so you end up with chronic pain. And then a new indication for Nevro, and I believe Nevro is the only company, am I right on that, with this FDA indication, is for diabetic neuropathy. And there's actually two big benefits to the diabetic neuropathy. Number one, well, the way diabetic neuropathy works is the high sugar levels basically the sugar attaches to the nerves, and it causes nerve pain because you've got these this coating of sugar on the nerves. And so these devices can not only help with that pain, and they also increase blood flow, which is very important to diabetics because sometimes you end up with poor blood flow. So it actually has two benefits, but it's now FDA approved for diabetic neuropathy. So here's a picture of one. So they're usually placed in the lower back through a needle. This is an outpatient procedure. It's actually very similar to an epidural injection, except you use a slightly bigger needle that this lead can fit through. And we use live x-ray, and it's got a little curve on the tip, so we can kind of drive it up that way and get it to the exact level it needs to be at for whatever type of pain the patient has. And it's in the posterior. And once it's in, really there's not much discomfort from the lead. The posterior epidural space usually doesn't cause any problems, so you can walk around with it. And you know, once it's healed and implanted, there's not really any major limitations. Like you can swim, you can do, you know, most things you want to do. Electromagnetic fields like an MRI, or there's certain precautions you got to take there. But in general, you can walk around, do most everything you want to do. Okay, so HFX is the high frequency that's specific to the Nevro, this brand of spinal cord stimulator. They're the only spinal cord stimulation system that's FDA approved to treat peripheral diabetic neuropathy. So again, they show in studies that nearly 80% of the patients achieve 50% or greater relief for 12 months. So that's actually this is part of the reason I am excited about what this therapy is offering people, because imagine if 8 out of 10 people here could get at least 50% pain relief, right? How meaningful would 50% pain relief be to you to have sustained pain relief for a year of 50%, right? It'd make a huge difference. And I'll show you some of our local stats here in just a second. So over 70,000 patients have been treated specifically with this therapy. So, you know, getting anything through the FDA takes forever. So before Nevro was even able to implant it in, you know, to go public with it, they had to do lots and lots of studies. So patients are able to trial or test drive the 10,000 hertz therapy to ensure adequate pain relief before committing to the implant. So this is important. So the way this works is, say you come in and talk with myself or one of the other providers, and you say, okay, I think I'd like to try it. So what we do is we implant one of these electrodes. You come in on an outpatient basis. We place the electrode. It gets taped to your back, and then it plugs into, instead of the spinal cord stimulator, you get this external device that we just tape to your back. And these little leads just snap in here and connects that way. So you get to try it for a week. So it's actually really neat. I think it's a great system that they've come up with. So you actually get to see if you like it. You don't just, you know, run to surgery. So you try it for a week, you walk around, you see if you're sleeping better, if you're able to, you know, do more activities, walk more. And then at the end of that week, you come in and we talk about it. And that's where we discuss the option if this is something that you feel is worthwhile and improving your pain symptoms enough. So patients are able to trial or test drive it. Highly effective for both back and leg pain. And I should mention here, we talk a lot about back pain, but it also works. We can do it, not as common for neck pain, to where we implant the electrodes. They still go in from the thoracic area, maybe mid-thoracic, and go up to the neck. So it can be used for arm pain as well. let's see, highly effective for both back and leg pain, superior to traditional spinal cord stimulation for relief. I'll show you some slides on that. And then it's paresthesia independent. So paresthesia means you don't have that buzzing, you don't have that tingling, which to some people is annoying. Now, I'll also say that Nevro can also do the low frequency just like the other kind. So that's another reason that I specifically like this type, that you can do the low frequency if somebody likes that or wants the traditional spinal cord stimulation. But of course, it can also do the higher frequency as well. So again, paresthesia independent, and you can use it 24/7. That was another thing. The traditional stimulation, some people didn't like it, so they would turn it down at night. You get a little remote control, so you can control it, turn it up, turn it down. And so some people would like turn it off at night because it was annoying. And so this thing you can leave on 24/7. Your brain does not perceive it's on, but your body does know that it's on and it's working. So let's compare it to traditional spinal cord stimulation. So traditional spinal cord stimulation gets 40 pain relief at 2 years. Now keep in mind, there's a little bit of a honeymoon therapy with any sort of therapy you do, right? So you get really good therapy and then you get a little bit of a drop off. But at 2 years, traditional spinal cord stimulation is 41% sustained pain relief, whereas at 24 months, the high frequency had 67. So that's a substantial, more than a 50% improvement over the other type of stimulation. So what are some of the other advantages? High frequency has demonstrated significant relief for both back and leg pain. It offers a wide variety of frequencies and waveforms that are able to individualize for relief for you. So, meaning, I tell people, I say, this remote control is like a TV remote control. You can turn it on and off. You can turn the volume up and down, so you can make it more intense or less intense. And then you can also change the channels or the programs. So they can put all different kinds of programs, and some people that can really be helpful, because there may be a program that you prefer for sleeping and one for walking around, or maybe one for sitting. So, and they're continuously improving this. They basically have a central database where, using AI, they're analyzing everybody's data and continuously looking what are the best programs, which ones are working best, and they train the local reps how to use those and implement those. High frequency stimulation isn't addictive and doesn't cloud your thoughts. Doesn't cause drowsiness, constipation like pain medicines do, right? So once it's in, there's really not a lot of side effects. I can talk a little bit about that, but there's no drugs involved. It's a mechanical therapy. It doesn't fix the problem, but it makes it feel a lot better. So that's the beauty there. It's not addictive, and these batteries last anywhere from 7 to 10 years. I believe their warranty is 7 years. 10 years, okay, even better. So once you get it in, you're good to go for 10 years. And then you can try high frequency in a temporary trial and decide if this therapy is right for you. So again, I've showed you some of these already, but top left, that's the trial battery. That's a temporary battery that we put in. This is the remote control you see there, bottom right, and there's the spinal cord stimulator that gets implanted. Again, very similar to pacemaker. And then you get a charger, right? Now they got cool inductive charging, right, for all your cell phones. It uses that same technology where you place a little pad over it, and actually it even comes with the strap, so you can walk around and charge it. So you basically place this little strap over you, and you allow it to charge. It usually takes about 2 hours. 30 minutes. They're getting even faster these days. So 30 minutes to charge, and you charge it usually every day or every other day. So it's not terribly inconvenient. Like I said, they have the strap that you can put around you, so it's pretty easy to charge and painless. So this is specifically our data for the last 52 patients that we've implanted. So this is local Sandpoint data of our practice. So 44% of the people have decreased their medication use. As you can imagine, sometimes it's difficult to get people to decrease on their medication, so almost half of them have decreased in their opioid medication use. 78 have improved in their sleep. Sleep is drastically important. I read a book not too long ago called Why We Sleep, Matthew Walker. Sleep is so important to every disorder. Your body needs that healing time. Your brain needs that time of sleeping. So 78% improvement in sleeping. 87% improvement in function. Like I said, that's the metric that I care about the most. Are people able to live their life? I tell people, listen, I can't make you live forever. Well, none of us, maybe we get to heaven someday, we'll live forever. But we don't live forever on this planet. And but we want to have the best quality of life that we can, and that really gives me, I think that's what keeps me going, gives me the most joy, is when you see people, playing with their kids, grandkids, being active, participating in life, enjoying their relationships. So 87% improvement in function, 77% achieve long-term relief, so sustained relief, and then 100%, I'm a big fan of the high frequency, so 100% of our patients are using the high frequency, but the other frequencies are available, and if the device starts having any issues, we can adjust it, they can program it. So, I keep looking there. This is Bryden, and Bryden is a representative, so whenever there's a problem or technical issue, I say, hey, call him. And there's a team of 3 of them for our little region here in the Spokane, Coeur d'Alene, Sandpoint area, and they take care of those, and they meet with the patients on a regular basis, even once you have it implanted. I want to show you just kind of a brief video that's a little bit of a summary of how all this works. It's about 2 minutes long, so let me see if...
A breakthrough treatment for chronic pain is here. It's HFX, a spinal cord stimulator, or SCS treatment option. HFX incorporates the most advanced SCS available, offering the widest range of frequencies and waveforms available to individualize your relief. It's FDA approved and is the only SCS system demonstrated to provide more people with significant relief from back pain, leg pain, and pain caused by diabetic neuropathy in clinical studies. Even people who have tried surgery and medications in the past may be good candidates for HFX. In fact, 8 out of 10 people who used HFX for severe chronic pain experienced a significant reduction in their pain, allowing most people to return to everyday activities and get back to what they enjoy. With patients suffering from chronic pain, abnormal pain signals are sent through the spinal cord to the brain. The HFX solution calms the nerves that carry these signals to provide lasting pain relief. In a simple procedure, thin, insulated wires are placed in the back near the spinal cord and connected to a small, implanted, rechargeable device. The device sends mild electrical pulses to the spinal cord to calm the nerves and reduce chronic pain. The procedure involves a relatively quick and minimally invasive outpatient procedure, which means you will likely go home the same day. You can use HFX 24 hours a day, including when you drive or sleep. Before committing to the procedure, you'll complete a 1-week trial where you and your doctor will assess its effectiveness in managing your pain. During the trial, the 2 wires are inserted in the back near the spinal cord and attached to an external battery. 9 out of 10 people who try the HFX solution stay with it. Ask your doctor if the HFX solution is right for you.
Okay, so a couple of things on who is eligible. Just a last couple of slides here. So who is eligible? These are the official FDA indications. So this is what we call on-label, which is chronic intractable pain of the trunk and or limbs, including unilateral or bilateral, means on one leg or both legs, or pain associated with either failed back syndrome, that's probably the most common one, somebody that's already been through surgery, and it hasn't worked, and they continue to have pain. Those with intractable low back pain, so now they actually got a kind of a blanket indication for just intractable lower back pain. And then leg pain, which is radiculopathy. And then, again, like I mentioned, this was actually a big deal. They got non-surgical refractory back pain, and then chronic pain associated with painful diabetic neuropathy. So these are the official FDA indications for this device. So what do you expect in the process? Number one, you speak with a physician offering the HFX solution. Find out if it's right for you. You can try the HFX solution in a temporary trial. It's just a week, so you can figure out if it works for you and how well it works for you. And then if it does, then we move forward to the implant procedure, and you can move forward with the implant. So conclusion, chronic pain is a problem for many people. Many treatment exists, including spinal cord stimulation. An advanced type of SCS, or spinal cord stimulation, called HFX, offers even more pain relief with none of the tingling of some of the other HFX devices. So there's our clinic contact number, and there's Bryden's email. Are we good to put that on there? And then, so your journey begins here. That's our mission, it's our goal, to help you have life more abundantly, enjoy better quality of life, better relationships.